What's eczema and how do we treat it? The skin can become red, swollen, or there can be little vesicles. Chronic eczema can become more scaly, but that's largely due to the scratch. It's typically found on flexor surfaces, and that means like the inside of the elbows, back behind the knees. The other thing to keep in mind is it's not what we call well demarcated, and basically what that means is that there isn't like a clear line where the eczema begins and where it ends. It slowly morphs from unaffected skin to affected skin. Flares can be caused by environmental irritants or infections, so according to the American Academy of Dermatology, the first-line treatment is topical corticosteroids, so things like hydrocortisone, but then you can also escalate to prescription-strength steroid creams. The second-line treatment is called tacrolimus ointment, and that's something that we can escalate to if the topical steroid creams aren't working. Then, if the topical options don't work, we can upgrade to biologic injectables, and this includes monoclonal antibodies such as dupilumab. Finally, another important note is that oral steroids aren't really recommended anymore by the American Academy of Dermatology, and the reason is this: while it might help reduce symptoms in the short term, when you go off of them eventually, it might cause refractory symptoms that are worse than they were before. As always, talk to your medical provider if you're concerned that you might have eczema, because they can provide appropriate treatment.